Well, hello there. Welcome back to another episode of Ask Amanda Anything. These are my bite-sized videos where I answer your questions about resumes, cover letters, and job search strategy. So today I have a few questions that came in that were similar in the sense that they all asked the question of what's the best way to get a job at blank. So insert this type of field or specialty here. So I'd love to group these together and answer them all together. So the first question I got was, how do I work at a school of nursing? And this is a great question. And, there are not a lot of nurse faculty members. The percentage of nurses or NPs who go into academia is a very small percentage. So it's always exciting to hear when people have this interest. Now, from my experience, these roles are occasionally posted online. So that is one way to start your job search for working in a school of nursing. But for this one, I'm going to recommend that you try your best to rely on some word of mouth or referrals. So this is a good opportunity for you to reconnect with either colleagues who you know work in an academic setting or professors that you have had, anyone that you've kept in touch with over the years from your own programs, picking someone's brain about, hey, this is something that I'm interested in. Can you recommend any schools that are hiring, or how should I get my foot in the door? This is a really good opportunity to use your network. And if this isn't you right now, this is a really good time to point out the importance of maintaining your network as time goes on. So right now you might be in school or getting ready to graduate thinking, why would I ever need to stay connected to my professors or my clinical instructors? And this is why. You may want to leverage this relationship in the future. So that's why now you need to be maintaining these connections. So that means once you graduate, making sure that you have some way of keeping up with those folks so that you can check in periodically, whether it's following them on LinkedIn or sending them, a holiday greeting card or something. Identify those people in your life that could eventually be beneficial to your professional career. And I think that, the best way to get your foot in the door typically is to find an adjunct or clinical instructor position. Those are usually part-time. You can usually do them in addition to your clinical role, and it can be a good foot in the door so that you can essentially have a working interview for a more robust faculty position. The second question I got was, should nurse practitioners apply to PA job postings? So should NPs apply to jobs that are advertised for physician assistants? And my answer to that is yes. 9 times out of 10, organizations utilize NPs and PAs in similar ways. And especially in the hospital world, especially in emergency departments, especially in urgent cares, for the most part, the scope of practice for NPs and PAs is similar. Now, this is not a commentary about scope of practice and independent versus supervisory practice. I'm talking about general skill sets and in the real world, how NPs and PAs are utilized. The exceptions to this would be something like a surgery position, because PAs do get more dedicated education in surgery. But for something that is in the specialty that you are competent in, that is your nurse practitioner prepared specialty, if you see a PA job and the only difference really is the fact that it says PA rather than NP and you fit the other qualifications, absolutely, I encourage you to apply. And it may be a good excuse or opportunity to also follow up and connect with whoever has posted the job to point out the fact that you still wanted to apply for this role, and that you would hope to be considered as a nurse practitioner because of X, Y, and Z. So it's an opportunity for you to stand out because you might be doing something a little bit differently in being one of a few NPs applying for the job. And in your documents, and then hopefully in an interview, if you get that, you can make your case for how, as a nurse practitioner, you may have something more to bring to the table if that's applicable to you and applicable to your circumstances. The third question I got was, what's the best way or the best strategy to get a nurse practitioner job in urgent care? I have 10 years of nursing experience in the ER. Now, this is a very specific question, but it brings up a good point of transferable skills and kind of specialty and industry knowledge. So for this individual in particular, I'm going to recommend that hopefully they've had an urgent care or an ER rotation as a student in NP school, because ultimately understanding of your role or your potential role as a nurse practitioner is going to be more valuable than having that experience as a nurse. And if you are a nurse practitioner, you understand what I'm talking about, that, even if you have ICU experience as a nurse, for example, the role of the ICU provider, nurse practitioner, is different. And having that clinical learning experience as an NP student will really enhance your understanding of the role and your marketability for that position. So I'm going to recommend to this person that they have an urgent care rotation as a student, and that they, on their documents, decide what parts of their ER nursing experience make them more valuable or more qualified for an urgent care position. So maybe they're not going to talk about working in the trauma bay or running codes or like the really critical things in ER, but maybe they're going to talk about how they worked in the fast track area and they're used to quick turnover and facilitating referrals and splinting and that type of thing. So they're going to identify what specific parts of their experience will make them most attractive for this role. And this is another plug where networking can really be beneficial. So if this person has 10 years of RN experience in the ER, imagine all those people that they know who work in the ER. So if they have maintained relationships with these folks, I would send out an email blast, not necessarily to multiple people, but I would pick 10 to 20 people that they've hopefully kept in touch with to email directly to say, hey, so-and-so, hope you're doing well. I'm graduating soon from nurse practitioner school, would love to work in urgent care. Do you have any, are you familiar with any urgent cares who are hiring? Can you connect me with anybody who may be looking for an NP in this field? Because urgent care and ER are very related. A lot of ERs also staff urgent cares. So this is an opportunity for this individual to really leverage any connections that they have with former ER nurses who may have moved on to another field, or with ER providers like other nurse practitioners, PAs, even physicians that they've worked with who can speak to their character and their work ethic and almost kind of sponsor them into a potential opportunity. So hopefully these questions have helped you and you've been able to pick out things that are applicable to your scenario. And until next time, remember, I am always rooting for you, and I'll catch you on another episode next week of Ask Amanda Anything.